All right, I think we'll get going. Good evening, everyone, and welcome. If you're just joining us now, if you could hover over your picture or your name, and you'll see an ellipsis or 3 dots in the top right corner. If you could type your name and your league, your local league. If you're not a part of the League of Women Voters, just write Friends of the League and your pronouns if you feel comfortable, and we will get going. I'm Maria Douglas. I'm the League of Women Voters, Diversity, Equity, and Inclusion, a senior specialist for the state, and I'm also part of the Ozaukee County League. Ozaukee County is the county directly north of Milwaukee County, and I am very shamelessly advertising 4 of our committees that are related to DEI. And if at any point during this presentation you would like, if you're trying to write things down, just grab your phone and you can just take a screenshot of these slides. But also, this whole presentation will be recorded and it will be on our YouTube page on our website. To get to the YouTube page, it will be in tools, toolkits and resources on the left side of the website, or in the very bottom of the page, you'll see a red YouTube symbol, and that's where you can find the recording. And without further ado, David, if you could share your screen.
Oh, okay. All right. Can you see the screen here?
Not yet.
Okay, let me try another. Is that better?
Not yet.
Yeah, okay, let's see.
I think Molly's in here still, so she might be able.
Oh, okay, wait a minute. I see. I forgot to click first to share screen. Let's try
Oh,
this.
there you go.
All right, here we are. Screen 1.
Wonderful. Well, this is David Egan-Robertson. He's a demographer with the Applied Populations Laboratory at the University of Wisconsin-Madison. And he has been so gracious to give this presentation to us this evening. This is similar to the one that his colleague Dave Long gave last year, but new and improved. And so I'd like to welcome David.
Okay.
David, I think there's a different view that you could go to as well.
Okay, let's see.
There you go.
How's that? That works? Okay,
Perfect.
very
Yep.
good. Okay. Good evening, everyone. There'll be some repetition of what Dave Long presented last year, but we have since he presented, some of the Census 2020 data has come out and is available to the public. Unfortunately, we don't have a lot of detail. I can give you some detail this evening. We're still waiting for a bigger release of data that's going to happen in May, where we'll get more detail about age, for example, and households and household relationships and things like that. But anyway, and with this talk, at least tonight, I can give you a broad overview of sort of recent changes in population trends in the state, just to give you sort of a broad idea of what's been happening in terms of overall population change. And then in some cases, I can also describe a little bit based on regions of the state and so forth. So this is, again, kind of I think I mentioned before, sort of a seminar. It's an opening seminar on demographic trends in the state. So I'm with the Applied Population Laboratory on the campus of UW-Madison. We're a clearinghouse of demographic data and products. We're within a department here called Community Environmental Sociology, which is in the College of Ag and Life Sciences on campus. We have 5 research and outreach staff. right now, and we view ourselves really as, demographic data providers and facilitators. Where some of the key concepts in terms of what an applied demographer does is that we assist with people with interpreting data, or we also sometimes develop data like estimates or projections, and it's all focused really on informing public policy and practice. And we help people understand the relationship between data about people and geographic places, whether it's the whole state or counties or local communities. So I always like to start with this slide here. Just to forewarn you, there's going to be a bit of math ahead. If you understand the text on this slide, you're doing great. Homer Simpson is happy to help us out here. But while I'll be putting a lot of graphs and charts in my talk, the important takeaway is not so much the specific numbers. After I'm done with this talk, I think this will be uploaded to your site, I believe, right, Maria? So if you want to go back and study some of the graphs in more detail and look at the numbers more specifically, they'll be there. The point of a talk like this is to really just give you an impression of how the population of the state's changing. And so that's really what I'm trying to create, even though there'll be a lot of a number of charts and graphs and so forth during the talk. I'll just start off and just some, okay, what's the population of the state? How has that changed over time? And when an applied demographer talks about recent change, we tend to think in sort of 20 or 30-year timeframes. So in my talk here, when I'm talking about sort of the state level population, I'll be starting a lot of times at 1990 and going up through 2020. With the counties, generally some of my slides here will just like start with 2000 and go through 2020. It's to help give a little bit of context. If we go back just a couple of decades and say, okay, how did the most recent decade compare to the one before that, and then the one before that? So it gives you more of a sense of the overall change across time. So the first graph here, I've just in showing, this is just total state population here. Back in 1990, we were just under 5 million. By 2000, we'd gotten up to about 5.4 million. So we added about 470,000 people during the 1990s. So it was actually a pretty big decade of growth. We gained almost 10%. In the 2000s, at 2010, we got up to about 5.7 million. So again, that decade, we added a little over 300,000 people, about 6% growth. And this last decade, you can sort of see the pattern. The growth of the bars is slowing down. So this past decade, we only added about 200,000 people in the state, or a little under 4%. And actually, the percentage change in the last decade, interestingly enough, was the smallest one since statehood, when the state was founded in 1848. So I've added a couple of sort of historic photographs of enumerators of the past. And they're somewhat anachronistic. I mean, you may have probably you may have filled out your census form this past go around in April 2020. You may have filled it out on the internet. And so you only get a visit from an actual physical enumerator if you don't fill it out on the internet or don't respond to a mail response at this point. So how does our change in population just compare to the country? Again, just giving some really, sort of high level views here right now. So the state since 1990 has grown about 20%, but you can see the red line here, the United States has grown by about 33%. So we've grown, about 1/5, and so we're lagging the national growth, which has been about 1/3 over the last 30 years. But when we compare ourselves to our adjoining neighbors, Wisconsin's actually not doing too poorly across this period of time. So again, as I mentioned, we've added about 20% over the 30-year period. Minnesota has actually, in percentage terms, has grown the fastest, up about 30% across those 30 years. And then Iowa's added about 15%. Illinois about 12%, Michigan about 8%. So actually, in terms of our immediate upper Midwest neighbors, our growth pattern has actually been pretty decent. when you look down below the state level, one way demographers and statisticians look at population change is sort of taking all the counties in the country and dividing them up into what we call metropolitan counties and non-metropolitan counties. And I've got a little definition here to the right of the state map that shows our 72 counties. So a metropolitan area has like a core area of 50,000 or more population. And then also outlying counties are, if they're connected by commuting patterns to that central core, they're also included in that metro area. It's kind of a funny definition because some parts of some counties, even though they're in a metro area, can be quite rural. For example, Iowa County, which is just west of Dane County. You drive out towards Dodgeville and you definitely feel like you're in the country, but actually enough people who live in Iowa County work in Dane County, so that Iowa County gets drawn in just by this statistical measure as part of the Madison metro area. So overall in the state, we have 15 metropolitan areas, 27 of our 72 counties. So a little over a third of the counties are within metro, are defined within metro areas. So when we look at the population change, and again, just going back 20 years in this case, when we look at splitting up the state's population in those metro counties and non-metro counties, again, you can see here the metro counties have been growing more rapidly than the non-metros. The metros grew about 7% in the 2000s and about a little over 4% in the last decade. And the growth in the non-metro counties, those 45 non-metro counties, it was only about a little over 3% in the 2000s, and then actually fell only to about 1.6%. And there'll be a few slides when a little bit later we'll start getting into why there's that differentiation between the metros and non-metros. So let's just talk a little bit about population by age. What's happening in terms of states' population by age groups? And right now, as I mentioned, unfortunately, we don't have really detailed data on age. Normally, when the detailed census data comes out, it's broken up into like 5-year age groups, so you can look at fairly small groups. And in fact, in some cases, even 1 year. The data is provided at 1 year of age, so you can get pretty refined. But right now, we can at least look at, okay, what's the youth population, what's sort of the working age population, and then what's the 65 and over population. So initially, just looking at the youth population in the state, you can see on this graph, it increased about 6% in the 1990s, but then started to decrease in the 2000s, between 2000 and 2010, about 2% down. And then actually in this past decade, it declined another 4%. So back in 1990, kids made up about 1 of 4 residents in the state, and now that's down closer to 1 out of 5. So what's been happening to cause this? Well, the main reason has been a real change in fertility patterns, and this is not affecting not only Wisconsin, but the entire country, and certainly a lot of other developed countries in the world, but particularly pronounced here in the United States. So from the last peak year of births in the state in 2007, when there were about 73,000 births, you can see in this pattern, the births have pretty much steadily fallen year after year. We've seen about a 15% decline in the number of births. And they rebounded slightly in 2021, but we'll have to see if that number now stabilizes. And an interesting thing to sort of think about, if the number of births had stayed at kind of the level back in 2007 to 2009, we'd have another 77,000 youngsters in the state. But again, just changes in fertility patterns have resulted in what some demographers are calling the birth dearth of the past 13, 14 years. Again, this has actually been even more pronounced when we look again at those metro and non-metro definitions. You can see on the left-hand side of the screen here, the metropolitan counties, the youth population held pretty steady from 2000 to 2010, but then fell a little bit, about 4%, which was the state, actually similar to the state pattern in the 2010s. But you can see in non-metropolitan counties have been quite a decline. It fell first 7% at 2010, and then nearly 6% at 2020. So in more rural areas of the state, it's a big issue in terms of the loss of children. As you can see, that I include a little chart up to the right. There's also a category of those non-metro counties that are not in any way adjacent to metros. They've actually lost, over the last couple of decades, they've lost 22% of their children. So if you think sort of like a school district in a rural area that might have had 1,000 kids in 2000, well, now then, they might have 750 or 800. So it's a big effect, and particularly in a lot of the much more rural areas of the state. What about the working age population? So I'm not sure this is the best illustration of the working age, but kind of on a Packer theme here. I don't know if these guys made it to work on Monday, but what's been happening? So we traditionally, define the working age population as 18 to 64. That population statewide from 1990 coming forward, you can see it grew quite a bit during the 1990s, about 12%. And then grew another 8% through 2010, but then really just pretty much stayed the same. But hardly any change between 2010 and 2020. And as a share of the state's population there, it's pretty much stayed the same. About 3 out of 5 residents are in that 18 to 64 age category. So we've if you remember here, so in the 2010s, the state's population grew about 4%, but the number of children declined, and the number of working age people pretty much stayed the same. So where are the additional people, so to speak? Well, they all aged. In Wisconsin, certainly there are some retirees that come into the state, but actually when we look at the numbers, sort of each decade, number of older people moving in is kind of offset by older people retirees moving out, to more of the Sunbelt states or something. But so the bulk of the change that's happened, and particularly in the last 10 years, has simply been the aging process. So in terms of just at the state level, in terms of the population 65 and up, increased about, as you can see here, about 8% to 2000, then about 11% to 2010. But now it's in this past decade, it's actually the population 65 and older actually increased 32%. So it's gone from a share of the state's population from about, sort of 1 in 7, the 13%, to getting close to 1 in 5 residents that are over 65 at this point. And again, looking at our neighbors here in the upper Midwest, you can see we all, so the bars sort of in the center of this graph are the Wisconsin and our immediate neighbors. And the percentage of people 65 and over are pretty similar across states. You can see it only ranges from about 16 to about 17.5%. So sort of similar sizes and proportions of elderly population in the upper Midwest states. I've included the what we'll call the outlier states, the states with the smallest and largest shares of 65 and older. Utah, being a Mormon, having a lot of Mormons, high youth population, only about 11% there are over 65. In Maine, again, sort of similar to northern Wisconsin, a lot of retirees in Maine. So actually they're up over 21% in terms of the population age 65 and over. So what's happened is in this last decade in particular is the baby boomer population has continued to age forward. So this graph here is the snapshot at 1990, and the baby boom generation is defined as people born from 1946 to 1964. So in 1990, they were ages 26 to 44, and that's delineated. You can sort of see in that graph on the left that most of the bars there, these are single years of age in that group. You can see most of the bars are, some of the widest ones are within the baby boom generation. So of course we go ahead 30 years later, and the baby boom generation is now 56 to 74. So about half the baby boom cohort has aged into the 65 and older group. So and that, you know, that largely accounts for the growth in the older population in the state. Now, we call these age pyramids, and you have to kind of just share my belief that it's kind of shaped like a pyramid. If we were in a say a more developing country, for example, it would have a lot more children at the bottom. It'd be much narrower at the top. And actually, the next slide will show you that part of our population here in Wisconsin actually does sort of adhere much more closely to the pyramid shape. So this next slide, I'm just going to compare the Hispanic population in the state with the white population. And again, these are estimates, the most recent estimates the Census Bureau has put out. And so here's the Hispanic population. You see, it's got a much more pyramidal type shape. Show a lot of younger people. In fact, 2 out of 5 Hispanics in the state are under the age of 20 right now. And you see it narrows a lot as you go further and further in the age pyramid up towards the top. So it's quite a contrast when we look at the white population in the state. You can see a big shift here. It's basically it's top heavy, you could say. But those of us who are in the group, like me, I don't mind being here. So, but anyway, you know, it's sort of really a tale of 2 different, in a sense. I mean, when you look at it demographically, there really are sort of 2 different states, and being maybe a little too broad there, but it just there's a real distinct difference between minority Hispanic population and white population. So as I mentioned, with this, Hispanics, 2 out of 5 are under 20. With the white population, 2 out of 5 are over the age of 50. So that was just sort of a general view. Again, you know, a lot of numbers, a lot of graphs. I'm just hoping you're developing an impression here of how things are looking in terms of the state's population, how they've changed. I'll just go through a few things about the sort of specific parts of population change that we look at as applied demographer, and so this kind of a basic lesson in about 15 minutes, maybe a little less, about what we look at when we're studying population change. So there are several broad measures of population change that we focus on. These are referred to as the components of population change. So we start off with births, that's adding to the population. Deaths obviously are subtracting from the population, and the difference of the 2 is referred to as natural increase. Now, this number could be negatives, or more appropriately called natural decrease, if deaths exceeded births over a period of time. The other component is migration. And again, this can be positive or negative. This is generally measured at what we call net migration. So that's the difference between the number of people moving in, the number of people moving out. So these 2 broad components, natural increase and migration, when summed together, equal the population change over a period of time. So I'll just start again by redisplaying this birth graph that I showed. So births being one of the plus values in population change have been falling over the last 14, 15 years. And when I graphed that along with the number of deaths that have been occurring in the state, it's produced ever smaller natural increase, and that's represented by the green bars on this graph. You can see back in 2007, the difference between births and deaths was 27,000. And you see just over every individual year, basically pretty much that natural increase has gotten smaller and smaller until in 2019, it was only about 9,100. And then COVID hit. As you can see here, we had like a 16% increase in deaths in the state in 2020 compared to 2019. And so we actually had a year where we had natural decrease occur. And that actually is the first year of natural decrease for the state since they've been keeping centralized records in 1905. So pretty grim statistic in some way, I guess you could say. In the most recent year, number of deaths did decline a little bit in 2021. There were fewer COVID-related deaths. Births rose a little bit, so we actually did have a slight natural increase in 2021. And you know, as I have here, 16% increase in deaths in 2020. I'd like to just provide a little bit of historical perspective when you look back at the Spanish flu in 1918. So at that particular year, and you know, it's also 1918 was the year in World War I where American troops actually entered the fighting in Europe. So there's a little bit of you know, the data is a bit muddled because of some mortality due to the war and mortality due to the flu. But actually, at least someone I found had done some estimates. About 1,800 Wisconsinites died in World War I, but 8,400 were killed by the flu. So nearly 4 times as many people, or a little more actually, than four times the number of people were killed by the flu than died in the war. So that just gives you a little, you know, it's kind of a morbid perspective, I guess you could say, on the comparison between, you know, what's been happening with the COVID pandemic versus what happened in terms of the state's mortality when the Spanish flu hit. So with the COVID pandemic, you know, it did have a profound effect on life expectancy. And you may have heard through the media always likes to pick up on life expectancy because it's a single number. It's calculated every year. And particularly when that number is going down, you know, the media loves to jump on the story. So you may have heard, you know, how life expectancy has fallen during the time of the pandemic. But it's important to understand when people talk about life expectancy, again, here's just part of applied demography lesson here. It's kind of a snapshot value, right? What it's basically is a one number summary of the current mortality patterns by age. You know, more appropriately, it's called a better term for it might be averaged weighted age at death, but that's a mouthful to say, and that sounds even more grim than life expectancy. So we use the term life expectancy. You know, it doesn't mean, you know, it's fallen by nationally, it's fallen by about 2.7 years in the last 2 years. So that doesn't mean all of us are going to live 2.7 years less. And it doesn't mean children who were born in 2021 are going to live an average of 76.1 years. It's really a relative statistic, but it allows you to compare across time for the same geography as we have here, you know, in the US across a 20-year period. Or you can use it to compare your particular geography against other geographies for the same time frame. But I also like, when I think about life expectancy, again, I like to take kind of a long view of it. This is the national life expectancy pattern going all the way back to 1915. And you can see its life expectancy in the US has increased gradually and steadily, particularly since the end of World War II. And you can see at the very start of the graph, and I'm just talking about the 1918 Spanish flu there, you see that big plunge in life expectancy. Well, that was because there were so many more deaths occurring that year. So it went life expectancy went from 51 to just under 40 for 1918, but then once the Spanish flu ran its course, life expectancy, because it's just really a one-year snapshot statistic, popped back up again. But an important contributor, let me see here, next slide. An important contributor to lower life expectancies in the past is greatly influenced by infant and childhood deaths. I've been doing some genealogical research recently about my family, and this is a picture of my aunt, my mother, and my uncle. I guess was taken probably in the mid-30s. They were born 1926 to 1933. But there's one child missing from the picture. A brother who was born in June 1932, but died at the age of only 16 days. And the cause of death listed on his death certificate was measles. So you may have similar family stories. You go back a generation or two or three of a child or children who passed away. Another generation back in my family, there were a couple of my great grandparents' generation. There were two families where 7 of 9 children survived. Child mortality was a big issue, even up as in this case up through the 1930s. And so many people used to die of infectious diseases like measles, and it tended to be the young. I found this graph. This is through the Center for Disease Control, just to give you sort of perspective on how the causes of death have changed across time. And this is going a little further back. They have data from the year 1900 and then also 2010 here. But 1900, more than half of all deaths were due to infectious diseases. That's the green part of the pie on the left here. So infectious diseases like the measles that killed my uncle in 1932. With the advent of vaccines and improvements in diet and medicine, deaths due to infectious diseases are just a sliver of what they used to be. And in the graph on the right, it's gone from 53% down to 3%. And the primary causes of death at this point are related, as we can imagine, to aging, things like cancer and heart disease, diabetes, and Alzheimer's. But even though life expectancy is fallen because of the pandemic, I like to really take a long-term view when I think about and try to discuss life expectancy and mortality in general. So finally, just to wrap up with a few notes about the other component here. I've talked about births and deaths, fertility and mortality. So this is the net migration in the state. So for the last 3 decades at the state level, as I'm indicating here, natural increase in these bars is represented by the green color. You can see it held fairly steady in the 1990s and 2000s, but then did fall off in the 2010s. And as I pointed out before, we've had a sizable decline in births and gradually rising deaths. So natural increase has decreased in the last decade. But net migration has fallen over time as well. That's represented by the orange in these bars here. In the 1990s, it was about 228,000, fell to only about 80,000 in the 2000s, and was only about 55,000 in the 2010s. So both in terms of natural increase and net migration, Wisconsin's kind of in this demographic double squeeze, where both elements of population change have been shrinking across time. And we have plenty of company. Most states, except really the ones in the South now, and the Southwest, are experiencing the same thing of lowering natural increase and shrinking migration. And to look at it, obviously, migration is both international and domestic or interstate. We use the term domestic to describe that. And you can see how this has varied across the last couple decades. We had very strong international migration in the 90s. That declined a bit during the 2000s, declined a little bit more in the 2010s. And then the domestic migration movement between states, our net gain was pretty solid in the 1990s, about 100,000, but then only about 10,000 in the 2000s. And then it was actually slightly negative in the 2010s. One thing that caused that particularly large decrease in the 2000s was the Great Recession, the housing market crash around 2007, 2008. And we found through our analyses that a lot of people were basically frozen in place. They couldn't sell the house they had been living in, so they couldn't move. It also particularly affected the retirement communities up north, where people, probably had second homes. They were thinking of retiring there, but they couldn't sell their existing home in a more metropolitan area. So that really produced a really slow decade of migration movement into and out of Wisconsin. Yeah, and so the next couple of slides are just to finish up. I took a look at what were the migration patterns between the up north area of Wisconsin and the rest of the state. And I know a lot of people have different definitions of what's up north. I just happened to take basically the 18 northernmost counties. So that's like one fourth of our total number of counties. And these counties really are all pretty similar. There's a lot of seasonal recreational housing, a lot of tourism activity up there. One very noticeable difference between these two parts of the state, when you look at the median age of the population in these areas. Up north, it's close to 50 at this point, whereas in the lower part of the state, it's down around 40. So almost a 10-year differential between those two areas of the state when you look at the median age of those populations. So this will come up. Okay, so this again is showing those up north counties on the right, and then the balance of the state on the left. You see natural increase has been stayed pretty steady in the southern parts of the state through the 1990s and 2000s, fell slightly in the 2010s. But the main thing I'd like to point out in here is really what's happening in the up north counties. You can see during the 1990s, and actually every decade since 1990, is that those northern counties have actually been in a state of natural decrease. So they've had more deaths than births up there. In the 1990s, they had quite a bit of inward movement, net movement, close to 40,000. That was slightly negative during the 2000s, but they did then bounce back during the 2010s. So there appears to be more movement of most likely the older retired population sort of returning to past migration patterns in terms of adding more people to those up north counties. Oh, sorry about that, I jumped too quick. Right, this talk today, I provided kind of a 30,000 foot view here, a lot of state level numbers, some data by broad categories of counties. As I mentioned, once we receive the more detailed data, particularly detail by age and household composition, things like that, it'll be clearer how these important variables have changed across time. But I hope I've at least given you an overview of what's happening with the state's population, and I'll do my best to respond to any requests.
Thank you so much, David. What a wonderful presentation and an overview of our state population and migratory patterns. As people, I guess, are migratory just like animals and birds and other things. In my neck of the woods, coyotes. And so I'd like to open this time up for any questions for David. And then we'll go into so what does this mean for League? If you have questions, if you look down at the bottom, there's a reactions, like a smiley face with a plus sign. You can click raise hand. If you hover over that, or other words like just leave your arrow on top of that smiley face. That's a way to ask questions. Dorothy.
Okay. I'm curious about whether you're going to produce the data on the various different demographics within all these numbers. And I'm especially interested in disabilities, plus knowing how are you going to measure COVID long haulers, long COVID, I guess it is. And how will you measure that? Because that's a whole new group of people.
Sure, yeah, that's a good point, a good question. You know, kind of a curious thing is that the census, where we look, you know, obviously rely on it because it's, you know, pretty much a full count of the population. You know, that occurred in April 2020, so it was really just really before COVID really hit hard. So, I mean, there is other data being collected by the Census Bureau. They're doing something, I think they call it the Pulse Survey, where they're trying, it does get tricky, you know, the Census Bureau collects all this data like in April 2020, and, you know, we're not getting really detailed stuff until 3 years later. So there's this huge time lag, unfortunately, with a lot of their work, but they've tried to move more towards doing something where they're actually doing household surveys on a for them, I may say for demographers, a rapid basis, you know, and producing new information almost on a monthly basis. So that would be a possible source, because I know they've asked a lot, you know, obviously over the last 2 to 3 years about people with issues. You know, are you behind on your rent? You're behind on your mortgage? You know, did you lose hours of work? Things like that. And there may be some health related questions in there. So data may be coming out over time more about that might get into more specifics, like in particularly long COVID and COVID related disabilities.
Thank you, David. Anybody else? Thank you, Dorothy. Don't be shy. Well, how about this? How about I move into my little shameless plug about our demographic survey and some other things we're doing at state, and then we'll open it back up to questions for David, our special guest tonight. Does that sound good to everybody? Thumbs up? All right. I'm going to share my screen. Okay. So if you missed this, this is, again, my shameless plug for all of our DEI related committees at state. And so I'd like just to take a few moments to share with you about them. The first one is the Transformation Committee. And this is a group for local league DEI committee members or prospective members. And the purpose is just to really be a support system for one another. You can attend once a year, 12 times a year as we meet monthly, or not, or once every 2 years, and you're just as welcome anytime. It is to discuss anything DEI related. And in fact, you could really, if you have DEI related questions and you're in voter services or MLD, you're also welcome to attend. Basically, everything that's said in this group is confidential, and it's a way to meet other league members from across the state and collaborate on projects, share resources. Then another committee we have, it's a longstanding committee of the state board, is a DEI committee. And this committee oversees the ongoing organizational implementation of our approved DEI policy. And then you also oversee me. So the time commitment for this is 1 hour per month. We do talk in depth about the DEI action plan and the strategic plan of the state league, taking into account local considerations and national trends. And The next one is the Community Alliances Committee. This committee is also a longstanding committee of the state board. It's a research group that creates tools to facilitate DEI efforts at the local level. So depending on the ad hoc committees you might join, the commitment's about 1 hour to 2.5 hours per month. So for instance, like the spreadsheets that we came out with and the pathways document for respectful conversation, those are products of the CAC. The land acknowledgement, that's a product of the CAC. And lastly, as some of you might have attended or at least might have heard about, we have had 2 multicultural adventure committees field trips across the state. And this came out of really Dane County and the Milwaukee County Leagues wanted to take a joint shared field trip to the America's Black Holocaust Museum in Milwaukee. And I said, well, hey, what about us in Saukee County and all the counties in between? And so we kind of formed this committee, and Mary Sussman, who's a DEI leader in Milwaukee County, said, DEI is so exciting. It should be so fun. And so this is a way to really make DEI come alive and bring people into the league, make it kind of exciting and immersive. And so really this is like a great way for people to get involved in a very bite-sized opportunity. And if you have attended any of my presentations across the state, I talk about bite-sized opportunities for friends of the league, which means non-members or people from the outside, and also for people in the league, you know, who might be, you know, a single mom or working 3 jobs. And basically the time commitment is just 1 to 2 hours of planning time per field trip. And we've already had 2, one in Milwaukee, one in Madison. We're planning one in the Menominee Nation. Dave Overstreet of the Milwaukee County League is an architect there. And so I think that's going to be when the weather's nicer. We are looking for people with great ideas so we can host these all across the state. So while we would have loved to invite our friends in Ashland Bayfield to the America's Black Holocaust Museum in Milwaukee, an 8.5 hour drive or 7.5 hour drive is something we weren't going to ask of them. So we're looking for leagues all over the state to participate. And then here we go. We are going to launch our demographic survey again. And it will take about 2 minutes for you to complete. This is very important information because it is a way that we can actually measure how we are decentralized, how our membership is becoming more diverse. And again, if you've attended any of my presentations or trainings, diversity comes in so many flavors, right? Ability, sexual orientation, it can come in all sorts of things, all sorts of ways, right? And so if you participate in this, we are going to throw in some swag. This is a hat that we were given. We were given actually a bunch of them, but I'm going to be giving out 3 and a random drawing. This is part of our vote tripling program initiative that the League of Women Voters, we co-sponsored with Souls to the Polls and launched in Milwaukee and Madison, and we will be launching around the state. Research shows that the most effective way to get out the vote is for people to text 3 to 5 people that they know. This program came out of UC Berkeley, I believe. And so this is what you can. And so please encourage your local leagues to participate. This will be, I think, the 4th year we're rolling out this survey along with the DEI survey. There are also questions in there about programming you'd like to see, questions you might have, etc. So it's a great way to stay in touch. And then one more thing, you know, the reason we launched this webinar again was directly out of your input from the demographic and DEI surveys. 90% of participants said, we want the Applied Populations Lab to present again. And so here we are. And so your information is very valuable to us. We really do pay attention, and this goes into all of our strategic planning and our trainings. And so we do value it tremendously. One more thing I'd like to add is I've created a dashboard for each of your local leagues. This goes to your presidents. It's not for everybody, but basically what Dave Long and Dave Egan-Robertson have helped me do is kind of collate the census data. And again, like he said, the 2010 census data has not completely rolled out. And a bunch more will roll out in May. And so I will have even LGBTQIA plus information, different categories that we have never really looked at before of who is in your community. I like to think if any of you have worked in early childhood education or are familiar with Sesame Street, I am both. Who are the people in your neighborhood, right? They're the people that you meet each day. That's kind of what the idea about this is. And so it's really thinking about who is in your community. Do they have voter information in a way or manner that they can understand? I mean, are we reaching out to them and including them in a meaningful way into our work? And so that's kind of the purpose. It also includes every year's demographic and DEI survey results for their local league. And so they can kind of keep track of year to year for their own league. And so just so you know, your presidents will have that, and perhaps they will share it with you on various committees. And so with all of that, I will turn it back to David for some more questions. Anne.
Good evening. My apologies for joining this presentation late. So it may be something you have covered, David, but I am particularly interested in what you have to say or might be able to tell us about the number of undocumented immigrants in our state.
Yeah, thanks for that question. Yeah, I didn't cover that in the talk. Yeah, I don't have figures just off the top of my head. But those are available, and it gets a little difficult. Obviously, it's a category over which there's a lot of political argument. So sometimes we can't get data much below a state level about that. There might be some estimates available at a county level, but I'd have to do some more research on that to actually find out. So right. So again, it is one of those things where actually, thankfully, the efforts of the Trump administration to put that kind of question on the census, was knocked down finally. Again, we're then relying on some, particularly like some national organizations that may do some sort of at least estimates at state levels, or possibly maybe some larger county levels.
Right, and I understand, and I wouldn't expect or necessarily want it to be part of the census for obvious reasons. But the fact is, I'm up in northern Wisconsin, and I'm aware of numerous farms that are almost exclusively run by people who are here as immigrants.
Right, yeah, unauthorized immigrants, yeah, right.
Or many, actually, because they come from countries like Nicaragua or Venezuela, then they're allowed in the country, and then they have this 2-year parole or not. I mean, it's all very slowed down. But the bottom line is, I don't think they're counted. And I was just curious if there's, I mean, we know they're in the millions nationwide, right? Probably
right.
15 million now, but nonetheless, thank you. I find all this quite fascinating. So I'm glad you're here.
Yeah, thanks.
All right, Dorothy Sky. Dorothy, our board president.
Yeah, Dave, this is an excellent presentation. Raises all sorts of questions and curiosities. For instance, I wonder, how the heck do you document undocumented aliens, immigrants? That's one thing I want. And the other thing I wondered, is there anything that demographers follow to document the rate of assimilation and intermarriage of immigrants with, what should I say, the previous generation immigrants? Yeah, that
Yeah.
for starters.
Yeah. So on your first question, yeah, how do you count people who basically don't want to be counted because their documentation is either shaky or they're undocumented? I believe, and again, relying on research that's done generally by a lot of national level organizations. I mean, they do ask through. The census has a rolling survey they call the American Community Survey, where they do ask questions about where was your place of residence in the past, and so through that survey, they're able to figure out, okay, how many people are reporting that they came from a foreign country, and then they can look at things like immigration and naturalization counts and say, okay, well, the ACS, the American Community Survey, is estimating these many people come from overseas. Here's the count of people who've been admitted through immigration and naturalization. What's that difference? And so it's kind of like a residual process in terms of how some of these big national research organizations are figuring out what's the undocumented population. And I'm sorry, your second question, if you're still on.
Yeah, how do demographers follow, if they can, the rate of assimilation? I would say beyond assimilation, I would say intermarriage.
Okay.
I'm just thinking of all of the folks that I know here in northern Wisconsin, for instance, that came here from foreign countries and practice medicine so they could get their green card and so on and so forth. And the children of those people have married the children of the local, what I want to say, previous immigrants, the ones from 100 years ago.
Right.
And how can demographers follow that any elements of assimilation, in particular intermarriage?
Yeah. I mean, there may be some academic research in that area. I have to admit, I'm not completely familiar with that. I mean, certainly what we're seeing across time is far more people in the census materials, whether it's the decennial census or the American Community Survey, that rolling survey that's going on all the time. People identifying 2 or more races in their backgrounds. That number's just shot up tremendously. I mean, by tremendously, I mean, in the overall population, maybe it's gone from 2 to 4% or something like that. But in many ways, I believe since 2010, the people identifying of 2 or more races, it pretty much doubled, I believe, from the 2010 census to the 2020 census. So yeah, there's kind of evidence like that, and you know, I have to admit there may be more academic research that I'm not as familiar with, that would get more into studying, you know, the intermarriage patterns.
I am one of those multiracial, 2 or more races, actually, David, but I'll pass it back to Dorothy for her follow-up.
I just wonder, David, can you give us some idea of who besides the League of Women Voters is hot on the heels of this data or asking for this data? Governmental, non-governmental people, who does this information go out to, and how do they get it?
Yeah, I mean, you know, it's used a lot by, I would say, like county planning agencies, regional planning agencies, you know, and I mean, there's a whole gamut of probably, you know, nonprofit sector organizations. But I mean, actually, you know, the biggest customers of census products are actually, you know, sort of the for-profit sector. I mean, businesses want to know, okay, who are our customers now, and who are our customers going to be 5 years from now? So you know, the data is used by a whole range of different organizations and groups. In fact, you know, it actually has been one of the biggest, you know, programs, the decennial census and the American Community Survey. You know, those are big information sources even for just businesses.
David, I have a question for you. What
Sure.
I found the most fascinating between all of our hours of conversation and preparation for this meeting, and for all the dashboards, is really, I was hoping you could spend 5 minutes just to explain like all the different sources of information that you pull this from. And also how some is reported on a municipal level, some is reported on a county or regional level, and others are reported on a state level.
Sure, yeah, I can.
And kind of the rollout of all of that as well, because I was so surprised to learn, my goodness, now we're in 2023 and not the 2020 census data hasn't fully been rolled out. So I was hoping you could, if you had a few minutes, to go a little into this.
Yeah. So yeah, just a big source of data for us is still the American Community Survey, and that does give information. I won't say rapidly, but more rapidly than, you know, what we get from the decennial census. So a lot of the issues that, you know, people raise here, like disability status and things like citizenship and you know, place of birth, if a person's born in another country, a lot of that will come up in the American Community Survey. Now the issue is that you know, it's a survey, and you know, as you're finding with your own survey work for the group, not everyone responds well. This is your chance to get some more swag. We'll put another plug in for League of Women Voters swag. You know, so the data, for example, the American Community Survey, I think they aim to interview like 3 million households in the country every year. And just to give you perspective, there are about 130 million households in the country. So, you know, it's about 2.5% that they try to hit each year. So the quality of the data, because you're relying on basically sort of 1 out of every 40 households, say, responding, when you group all that data together at a state level, you know, generally you get pretty good estimates. When you go down to county levels, well, bigger counties, the estimates are more robust. they're better, more trustworthy quality. And then it does, I mean, it gets tricky when they try to push it down to like a municipal level. What they do for smaller communities and smaller counties is they actually group the data across a 5-year period. So it doesn't have quite the currency of data that larger places get, which is normally on a 1-year basis. But at least, you know, again, it gives you sort of a picture across a 5-year period of what, you know, various indicators, various demographic indicators are in that area. So at least, you know, at least gives you a basis. For example, if you want to look in a smaller area about veteran status or disability, again, is another example. You know, you have a 5-year period of data. You know, again, it'll be better quality if it's a larger population area. It'll be decent quality if you're looking at a smaller population area.
And what are the sources of data that you're pulling from other than the American Family Survey and the census?
Yeah, I mean, I really do rely a lot on those. Those are sort of the big ones. There are some other surveys that are done by various national governmental organizations, but unfortunately, a lot of those, you know, you can't really push down very far. There's some that get into, say, more things about health issues or healthcare issues. Sometimes those can be reasonably good at a county level, but generally, you know, if you're going down, trying to go down below a state level, it can sometimes get a little dicey with some of those. So it is a tricky. It's, you know, these national agencies are doing these really large surveys. But when you try to sort of, you know, distill the data down to a really smaller geographic level, you know, your margins of error that are involved with those estimates tend to drift upward, and so they become less reliable.
Dorothy.
David, I have a question for you as someone who deals with these statistics day in and day out for your profession. Two questions. Are there some, does it make you curious about certain things, wish or look forward to the details, or wish there were ways to get more details? So the things that puzzle you or make you more curious about these numbers, that's one question. And the other related question is, we hear the old adage about how you can lie with statistics. Do you see numbers here that may be, let's say, misleading or dramatically incomplete for some reason?
Yeah, so on your first point, I mean, one thing we do not have good measurement of in this country is what we call gross migration. You know, I mentioned in the talk about migration being a component of population change, and generally all we're able to really get our hands on or grasp is the net migration. It's the difference between the number of people moving in minus the number of people moving out. And that would give you, particularly for, well, it's an interesting number in both directions, right? If people are in-migrating, you want to know, okay, what's that pool of people moving in? What's their ethnicity, you know, income levels, age, things like that, as well. You know, who are the people moving out? You know, are a lot of young people moving out? We know in general there's sort of that process, certainly around the college age, that happens. So you know, that's kind of a blind spot in terms of demographic data. We don't have a really good handle. We don't keep really good track. There's no great way to keep track of people when they move into one area or leave another area. and there is some use of like IRS records because if most people are filing in 1 year and they file in the next year, if their addresses change, you can say, oh, they must have moved somewhere. So it covers most of the population, but it's not super solid. And again, you know, when you're filling out your federal tax return, you're not saying anything about yourself other than you know, only a very broad definition of age or blindness. You know, I think those are the only real demographic indicators on your federal tax return. So it doesn't, you know, give any other information other than the fact that you moved. Yeah, in terms of yeah, there's always a risk of you know, data being misused. You know, I can't think of anything sort of well, actually, I mean, you know, international migration obviously is a super hot political issue right now. So you do have, you know, different think tanks in Washington, one that's say more pro-immigration, another one that's, you know, anti-immigration. You know, they'll take the same numbers and, you know, they'll produce two totally different reports on what they think is happening. So it is, you know, you do run into things like that where people, you know, do apply their own interpretations to the data. So you just have to be pretty, you know, pretty thoughtful and skeptical about, you know, what you're reading. And, you know, a lot of my time, I have to admit, is spent looking at things like technical documentation and methodologies and, you know, assumptions that people make when they're putting out a report that has data in it.
Well, thank you so much for this wonderful and thoughtfully put together presentation and for your continued partnership with our work. And with that, we'll conclude for the night. And again, if you have any questions regarding this or the demographics of your league, within the boundaries of the league, please feel free to reach out to me. My information is on the state website, and I know how to get a hold of David Egan-Robertson. So good night, everybody, and thank you so very much.